Today I speak on behalf of over 11,000 members who are the clinicians who practice in all specialties and who see patients every day in every corner of the Commonwealth. The MSV's vision is twofold: to make Virginia the best place in which to practice medicine and receive care. Fulfilling the receive care portion of the MSV vision statement is a predominant factor in our advocacy efforts to find ways of covering the uninsured in Virginia. During the past General Assembly session, I spoke with many of you and many of your colleagues in the House about how to get our patients the care they need in the correct setting, which is not always the emergency department, and also how to address their chronic health care problems earlier, before they become emergencies. I've often mentioned a patient of mine who I treated for many years, who in 2008 lost both his job and his health insurance. Several years went by before his wife was able to convince him to visit the office to see me, and even though he still lacked his health insurance. When I saw him, it was immediately apparent that he was gravely ill. His refusal to seek medical care and visit a physician was due to his fear of financial insolvency for his family due to medical bills. He died 18 days after our visit of a bile duct cancer. Well, I don't know if I'd been able to see and treat him earlier in the course of his disease, whether or not he would have survived. At the very least, I could have reduced his suffering. I think each of us would agree that the Patient Protection and Affordable Care Act is far from perfect. Physicians would also add that Virginia's Medicaid's low reimbursement rates and excessive administrative requirements preclude some of our colleagues from seeing Medicaid patients. However, railing against the PPACA and Medicaid in its current form doesn't help our fellow Virginians get the medical care that they desperately need. On previous occasions, MSV has weighed in with the Merck, DMAT, the Secretary of Health, about common sense reforms that from the physician perspective would improve the efficacy of the program and efficiency of the program and make it easier for physicians to see and care for our patients. We've seen progress on many fronts. The free market principles embedded in the proposals you're considering are consistent with our interest to improve the efficiency of the Medicaid system. We appreciate the Senate's efforts to close the coverage gap. Physicians are committed to being part of the conversation to find solutions that work for our practices, for our health systems, and most importantly, for our patients. We believe that closing the coverage gap is an integral part of that equation. MSV looks forward to continuing to work with you, other legislators, and our partners in the healthcare and business communities to reform Medicaid and find a Virginia way to cover the uninsured, thus helping to make Virginia the best place in which to receive medical care. Thank you.
Thank you, Doctor.